Hi all, I am Dr. Muhammed Shafeeq, specialist pulmonologist from Aster Hospital. We know nowadays the entire world is going through a difficult phase of COVID-19 pandemic. So today I would like to share a few words regarding smoking in the context of COVID-19. As we all know, COVID-19 is an infectious disease caused by severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2, which mainly attacks the lungs. Smokers are in general more prone for developing respiratory infections, including bacterial and viral infections. A review of the studies conducted by various public health experts convened by WHO on April 29, 2020 has found that smokers are more likely to develop severe disease with COVID-19. Early researchers also indicate that compared to non-smokers, a history of smoking may substantially increase the chance of developing adverse health outcome in patients with COVID-19, including admission to intensive care units, development of acute respiratory syndrome, requirement for mechanical ventilation, as well as other severe health consequences, especially when there is a history of smoking and when they develop COVID-19. Now, why this happens? Why smokers are more prone for developing severe disease with COVID-19? There are various explanations for the same. First of all, smoking hinders the natural defense mechanism in the lungs. Smoking impairs the mucociliary clearance in the airways by affecting the ciliary function as well as inducing excessive mucus production in the airways. And smoking also affects the function of the alveolar macrophages as well as the surfactant function in the lungs. Smoking induces a chronic inflammation in the lungs. Because of all these reasons, smokers in general will be having a compromised lung function compared to non-smokers. Apart from reducing the local immunity in the lungs, smoking also affects almost every organ in the body. It also has a negative impact on the body's immune system. Smoking impairs the body's ability to utilize oxygen effectively. All these factors makes it really difficult for the body to fight with the virus once they get infected with SARS-CoV-2. Also, we know smoking is an independent risk factor for various other non-communicable diseases like cardiovascular disease, chronic lung disease like COPD, cancer, and even diabetes. And individuals with these underlying conditions, once they develop infection with SARS-CoV-2, they are more prone for developing severe disease. And the act of smoking involves frequent contacts between the lips and the fingers. That of course increases the chances of getting infection. And also the habit of sharing tobacco products like cigarettes, e-cigarettes, shisha, as well as water pipes, especially in social and communal settings, also increases the chances of transmission of disease from person to person. So to conclude, in this context of COVID-19 pandemic, I would like to say all smokers should quit smoking right now to prevent COVID-19 as well as to prevent its complications. Thank you.